Do you ever work with scar tissue that just is too tender or painful or just doesn't want to let go? Then listen into this episode as I talk about ways to help scar tissue to release.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody, and welcome to this episode where today we're going to be talking about scar tissue formation. And we know in the postpartum population, we're either dealing with cesarean section scarring or vaginal tears or episiotomies. And let's kind of talk a little bit and understand more what happens during scar tissue formation. It's also known as fibrosis, and it's a natural part of the body's healing process. And scar tissue is composed of collagen, and that is a tough fibrous protein that provides strength and structure to our tissues. And the healing process, actually, when the tissues are injured from the surgical cuts or the tears, the body initiates that healing process. And the first stage of scar formation is inflammation. So that helps to clean the wound and remove any debris, bringing immune cells into the site of injury. And then there's proliferation with the scar tissue, the cells proliferating to help heal the entire area. And then we have the repair phase, or the remodeling phase of the scar. And this can take anywhere from 9 to 12 months to get to the remodeling phase. Fibroblasts actually come in and produce collagen to replace the damaged tissue. Then the scar has reached its maturation phase. And in the maturation phase, that can last anywhere from 12 to 24 months after the injury or surgery. And so this process can take a while. And, I've always wondered how long scar tissue continues to form. And if, it's at a mature phase 2 years postpartum and we release the tissue, does it remain that way for the rest of their life, or does it tighten back up? And I don't believe that we've done enough research to really tell. I know from talking to other body workers who have had C-sections, they feel like it continues to tighten and needs continual work for the rest of your life. So I think that it's always important that we let our clients know that this is something that they should always be checking in with. I think that vaginal scarring is so much easier because if they're having penetrative sex, that is a great mobilization to that tissue, and that can really help keep the scar tissue at bay. However, the lower abdominal area does not get that same type of stretching and mobilization. And that's where I feel like we really need to be instructing our moms to pay attention to this for the rest of their lives and make sure that there's good mobility in this area. Now let's talk about the different types of scar tissue that we may find in our clients. There are hypertrophic scars, and these are usually red and raised, and they tend to stay within the boundaries of the original injury, but they may gradually fade over time. However, keloid scars are a type of hypertrophic scar, and that can extend beyond the boundary of the original injury. They are way more extensive, and they may require more intense treatment for them. Atrophic scars are when there's an indentation or depression or a pit that appears in the scar, such with acne. We're not going to see this much with C-section scars, but there's also contracture scars that can occur over a joint. And again, we're not going to see that in a C-section scar or a vaginal scar, but just so you have an understanding of the different, there are many different ways. I'm sure you have all seen the variety of scars in your practice, and just how some people, I tell my clients, I'm like, oh, you're not a good scar producer. And they look at me and I'm like, that's a good thing. People who are really good scar producers, that's not a good thing, because it just creates more havoc and more restriction in the tissues. So what factors the formation of scarring? Well, number one is genetics. So some people are just more prone to forming certain types of scars, and it's just genetic. The wound location can impact scar formation with limited blood supply, like joints. But when we're talking about C-section scars and vaginal scars, there's good blood supply there. But the tension on the wound, so high tension or stress on a wound can lead to formation of thicker or more noticeable scars. And then also infections can also cause it. And I want to add to this that also emotions and trauma can create tension in the wounds and create thicker scars that tend to be more tender. And I had a client come to see me 5 years after her cesarean birth. And immediately after the birth, she started having lower abdominal pains. And she went on to have 2 other exploratory surgeries, and they found nothing in there. And really, what was creating the pain was the trauma from the cesarean birth. And when she came to see me, she had been dealing with this pain for 5 years. And in one session, we got the pain so diminished that she came in the second session and was just blown away by how much better she felt and how quickly she felt better, because we addressed the traumatic experience of the C-section. It was an emergency one, so she wasn't planned, she didn't want it, and just the way things unfolded, it was too much for her body to process and to handle, and that's what creates that trauma response in the body. And so we just helped her replay it, reprocess it, and the tissues just melted. And that's the biggest point that I want to get in this podcast to you, is that when you're working with scar tissue and it's really thick and it's really tender, I invite you to step back and not be as aggressive with that type of scar. And let's ask the client to connect into more with the tissues that you're sensing and feeling, and help them just breathe and bring their attention awareness down to it, and see if there's anything that comes up for them when they just tune into this area. Because a lot of, C-section scars, one of the most greatest indicators that they're holding trauma in their C-section scars if they can't touch it. And if your client's like, oh no, no, I can't even look at it, that's a sign that there's more going on there. And if that is the case, I would really caution you to just going boom right and putting your hands right on that C-section scar. I would encourage you to start more up at the chest or at the rib cage, the upper abdomen, and kind of let the body work somewhere else first. And then make your way down to that area. Let their body get used to your touch, doing something else on the body before you go straight into that C-section scar. And see if you can, have them stay connected to your touch as you work your way down the body, so that they don't disconnect from you as soon as you go in and touch to that area, that they can stay present with you to help reconnect into that area and see what's really being held in that tissue. That the ability to see if someone stays connected to your touch in your hands is something that we cover in the Birth Healing Intensive program. So if you're curious about that, you can join us in that program and you'll learn more about how to do that. And also processing the emotions and how to replay the birth so we can help clear out that trauma. All of that is covered in that Birth Healing Intensive program. And so if, I had one client that came to see me and she had a vertical C-section scar, and this was probably 7-8 years ago. And so that's just unheard of these days. And so she was so pissed at the surgeon that up by her belly button, there was like an inch of that scar that was as thick as my thumb. And as I tuned into it, I could immediately feel her anger towards the surgeon. And when I helped bring her awareness to that area, she immediately goes, oh yeah, I'm pissed at that surgeon. And we just helped her to process that. And as soon as she did and was able to release her anger, the C-section scar was only as thick as my little finger. So it went from the thickness of my thumb to the thickness of my pinky. And that's what can happen when you get to the emotion that might be held in that scar tissue, or the trauma that might be held in that scar tissue. And I just really encourage you to start paying attention to what are you feeling in your fingers? What are you feeling in the body with your hands? What's the sense of the quality of that tissue, the quality of the restriction that you might be feeling, maybe the tension in the muscle, or the tension in the bone or the ligament, whatever it may be, and get really curious with it. And if the tissue is not responding to your mobilizations, your compression, or whatever, bring your client's awareness to that area and bring their breath and awareness, and just see if that alone changes things. And that is your first step. And if that doesn't change anything, please don't go force something to happen. It's not going to help you out. It may help you release it in that moment, but most likely it'll come back. And it may come back with a vengeance, and we really don't want that. So, really pay attention, like, what do you sense in that tissue? And this is where we need to access more of our intuition, our interoception in our body, which may be a signal to what's going on. In that, if you're an empath or you're empathic to sensing and feeling what others are feeling, that is a gift. That is a skill that you can use when you're working on the body to help guide you as to what it needs, what's going on in there, and helping them to release whatever they're holding in that tissue. So if you're working vaginally with scar tissue loves gentle compression. And so if you have your index finger in vaginally, you can use your thumb externally and try to compress that scar tissue between your fingers. And if it's on one side or the other, I always offer medial compression to the ischium to help slacken that scar tissue even more. That will help it to release even more. And so as you're offering compression to that tissue, get really curious with it. Sense into that tissue. What do you sense about that tissue? And then bring their breath and awareness down there and see if that shifts and changes anything. And if you really want to dive into the magic of being able to help tissue fully release, please join me in the Birth Healing Intensive Program. It's going to be starting in February of next year. We're going to have early registration starting the end of November. So I would really, really encourage you to join me in that program. It's a 9-month program. It's going to be taught online via live or online lectures, and then group calls once a month. And then there is an option to come in person at the end of it to practice these techniques hands-on with each other. So I'm really, really excited about this program, because it's just, that's where the deep intensive healing happens. The program is designed to help you to do your own healing so that you can better serve your clients. And while you learn how to heal yourself, you're learning how to heal others as well. Okay. So that is what I want to say about scar tissue. Would love to hear your thoughts on it, what your experience is with it. Give some of these ideas a try and let me know how they work for you. Okay. Thanks so much for listening in. And here is to smoother births and faster recoveries. And we'll see y'all in the next episode. Take care. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.